In this video, we'll talk about what to do when you accidentally took too much insulin. First, eat a lot of carbohydrates to prevent blood sugar from going too low. Second, check your blood sugar more frequently, maybe every 20 to 30 minutes. If blood sugar drops low, you can always eat more. If you took way too much insulin and your blood sugar was low to begin with, you may consider going to the emergency room. Now let's look at some examples. This is a gentleman who is supposed to take 60 units of Lantus every morning and 10 units of Novolog before each meal. However, he was confused and took 60 units of Novolog and 10 units of Lantus before breakfast. He was fearful that blood sugar would become too low. His blood sugar was only 85 even before taking insulin, and he had seizure before. For this patient, his blood sugar was already low to begin with, and he took way too much short-acting insulin, 6 times more than he was supposed to. On top of that, the consequence of hypoglycemia is very serious for him. It will trigger seizure. Therefore, I recommended that he call 911 and eats a lot of carbohydrates while waiting for the ambulance. Eventually, he had to receive sugar through the vein and glucagon shots in the emergency room. The next example is a lady who was on metformin, Victoza, and Levemir 20 units every morning. She also took 5 to 10 units of Humalog before each meal, depending on how much carbohydrate the meal contains. This morning, she was confused, took 8 units of Levemir and 20 units of Humalog before breakfast. Blood sugar before breakfast was 260. In this patient, her blood sugar was high to begin with, so it's less likely to go too low. In addition, she only took less than 3 times more than what is supposed to take. I asked her to eat a large meal and check blood sugar every 30 minutes for the next 4 hours. Over the next 4 hours, her blood sugar had never dropped below 160. You might ask me why monitoring blood sugar for 4 hours, not 3 hours or 5 hours. It's because Humalog, the insulin that she took too much, only lasts for about 4 hours. If blood sugar has not dropped in 4 hours, it's unlikely to do so after that. So after the 4-hour period, she took additional 12 units of Levemir to get a total of 20 units Levemir for the day. The reason for doing this is because Levemir is a long-acting insulin that lasts almost a day, but she took too little Levemir before breakfast. If she does not catch up with more Levemir, blood sugar will spike up later in the day.